So hi everybody, I'm Sarah. At the end of 2016, I survived pneumonia and sepsis. I'd never heard of sepsis before, but sepsis has changed everything. My entire body, my mind, my business, and my personal life. Now there's life before sepsis, and there's life after sepsis. So I want to thank Christina and Vida for being allowed to speak today. And when I first got in contact with Christina, she asked me, did I think I might be able to speak for about 15 minutes about what had happened to me. And I laughed and I said she didn't know me very well yet because I can talk the hind legs of a donkey, and really she was better to set me a time limit. So fasten your seatbelts, I talk really fast. So this is my story. So I'm probably better known as an artist and goldsmith, and I've been making jewellery for nearly 25 years now. I make everything from challenging exhibition work through to commercial production lines and high-end one-off client commissions. I'm also a business coach for artists. Years ago, I spent 7 years of my life researching for a PhD in jewellery history, but that's another story. So you can say that I am a doctor, I do carry that title, but I'm not the same as you guys, I'm not a medical one. And I also lecture, teach and write. And of course, I'm a wife and I'm mum to Ruby and Rosie. So you could say I'm a really busy person, I'm always on the go. So my story starts on a Monday night. I wake in the middle of the night feeling extremely sick. Now that's not so alarming for me, as I'm a long-term irritable bowel sufferer, and I just thought I'd eaten something that agreed with me, or that my mum had cooked something that had poisoned me and given me something I shouldn't have eaten. On Wednesday morning, I woke up feeling really rough and thinking I'd just caught a bad cold from one of my daughters. You know, sore throat, runny nose and a cough. I also got my period at the same time, and I thought, well, that's just great, no wonder I feel so crap. I continued to work through it thinking, well, I'd feel better in a few days, and really I didn't have time to be ill. It was a mega busy time of year as it was late November and I was working full pelt on my client commission pieces, and we were trying to get our studio set up for our Christmas show. So isn't it bizarre that in these last set of photos I took on my phone, which you can see on the slide, I'd staged my client's piece of gold up like a little Pac-Man eating some flowers, whilst inside that's exactly what was happening to my blood. Over the weekend, I attended a training class that I'd been doing, and again, bizarrely, we were learning about red blood cells. I remember not really being able to concentrate on what the lecturer was saying, but the others had been laughing about how the speaker was so boring, so I really didn't think much about it. All of a sudden, after lunch, I began to feel really terrible, heavy, even like lead, and I realised that my entire body was shaking. I was cold and my teeth were chattering. So I put on my cardigan because I just assumed I was cold, but at the same time, I was also sweating. I took a hot drink, paracetamol, and another painkiller called Advocacy, which I use because I'm allergic to ibuprofen and codeine. I managed to make it through the lesson, and on my way home, I stopped off at Tesco's to buy a big bag of lemons and a bottle of whiskey. I thought that a few good old-fashioned hot toddies before bed would do the trick, and later Ian and I shared a bottle of wine. I then wake up at about 2 a.m, totally drenched in sweat and feeling like I might die. I felt so horrendous, but I blamed myself for mixing the hot toddies with the wine, and I just thought I had a hangover. But really, I had only had maybe 2 whiskies and 3 glasses of wine. And I can drink a lot more than that, because I'm Irish after all. So I spent the next 2 days totally comatose in the bed, and I mean comatose. I can hardly move. I ached all over and I felt like I was super glued to the bed, like I was being pinned down by gravity but sucked into the bed at the same time. And I couldn't speak, which is a humongous thing for me. And when Ian came in to ask me questions, I just grunted at him. And I had a constant temperature hitting around 39 to 40 degrees. I continued to totally sweat the bed, so much so that Ian slept on the floor. In fact, I was so drenched in sweat that you could see the water dripping off the soles of my feet and the palms of my hands. At the same time, I was absolutely freezing, and my teeth chattered like one of those little wind-up toys you used to get as a child, and my whole body shook. At one point, I had on winter pyjamas, a vest, woolly socks, and my dressing gown pulled up with the hood pulled up because I just couldn't get warm. And we all thought I just had a bad flu, and my mum chortled at me and said, "This is what happens when you're anti the flu jab, and now look at you lying in the bed and you've got the flu." On a Sunday evening, I tried to watch something on the TV, and I remember that I was having a hard time even seeing the screen. I couldn't focus or concentrate on what was being said, and it was like trying to watch something when you're drunk. So I looked out the window instead, and I noticed how psychedelic the sky was outside, reds and flashing yellow lights. And I took a photo on my phone, and I thought, wow, look at that. And I checked the phone, and I thought, yep, I caught that one real well. And if you look at the slide, you can see the image on the right is what I thought I saw. But when I found the actual image on my phone a few months later, which is the one to the left, I was shocked at how very dull it was. Then the whole room turned grey, and I thought to myself, God, this room is so dull. I haven't noticed that before. Have those curtains always been that drab? I'm going to have to sort that out. But our colours are duck egg blue and warm wood tones. And being an artist, I should have known that affecting my colour vision, there must have been something wrong. Shortly after this, the pain in my chest and back started, pretty sharp, and I thought I must have hurt myself coughing. My mum was rabbiting on again about, careful, that's not pneumonia, and I told her to stop scaremongering, and she was just being paranoid, as 6 months previous to this, we had watched my grandfather die of pneumonia, and my father had had critical pneumonia before he died 3 years previous. Ian convinces me to go to the out-of-hours doctor, and on the way over, I remember looking out the window at the night sky and seeing a big alligator's head in the clouds eating another cloud. And I said to myself, oh, that's nice, that must stand for strength and having to overcome obstacles. The young doctor said that my breath sounds were pretty clear and my temperature was obviously under control with the painkillers I was taking, and my blood pressure was only slightly raised at this point. But then she checked my heart rate, which was at 120, and she said she just wasn't happy with this. She didn't like the chest pains, she didn't like the cough, the pains in my back, the racing heart, and the fact that I hadn't moved in 2 days. So she sent us to A&E. This is my favourite part of the story. We arrive at A&E at about 10:30 p.m. The triage nurse took my temperature and says, oh, it's 37.7. And I tell her that that's good. It's actually been in the 40s for the past 2 days. But she doesn't write that down in her notes. In fact, she doesn't ask us anything else. She tells me to take my dressing gown off and gives me some paracetamol. And I came in as an emergency, but I was not treated as time sensitive. And so in between getting bloods taken, an ECG and a chest x-ray, we wait in A&E for nearly 5 hours. Finally, we are called in to see the doctor, and I'm thinking, great, I'll get to speak to someone now. He stood in the middle of the room with a clipboard in his hand and a packet of pills on it. You have a bad chest infection, he blurted out abruptly. What do you mean? Asked my husband. Well, you know, it's pneumonia, he said in a curt tone. I was shocked by this and I needed to sit down, and he looked surprised, but he sat down beside me. And you're sending me home, I asked. I'm giving you these antibiotics to take, he said. Are you sure I can take those, I asked. I'm allergic. You're allergic to erythrocytes. Oh, I can't even say it today. You know what I mean, he says in a sarcastic voice. No, I'm an anaphylactic to erythrocytes. I can't even say it again. Penicillin and cephalosporins. Are you sure that I can take those? And he slams them down on the desk and he says, this is what I'm giving you. And what about the fast heart rate, I ask? That's perfectly normal with an infection. And are you going to help me with my breathing? The best thing you can do is go home and take these antibiotics. And I go to ask another question, and he stands up and he opens the door and he says, it's time you two left. Part of me knew I should not be going home, and I was calling him all sorts of bad names in my head. Part of me thought, well, he's the doctor, so he must be right, and there mustn't be anything really wrong with me. But I know now from my notes that white blood cell count had already reached 15.6, my liver function is out, and my CRP level has hit 404. We live 15 minutes away, and within 20 minutes of leaving the hospital, I had deteriorated, vomiting and diarrhea. I try to take the first antibiotic, and I tell Ian he needs to watch me for anaphylaxis. He's snoring within about half an hour. It's around 4:30 a.m. by this time, and the vomiting and diarrhea continues, so it's highly unlikely that any of that first antibiotic is even in. I get worse during the night. The pain in my back is excruciating, and I can't get comfortable. I can't lie down, and I can't sit up. I can also feel the fluid constantly filling up in my lung, like a constant trickling or bubbling of water, a bizarre feeling, exactly like when you have the cold and a nostril is blocked up and you can't breathe. Similar to that, except you can't breathe through a lung, which is frightening. And the mucus is coming up rather than down, and it has a strange, bitter taste. The next morning, Ian says he'll make me some porridge to see if I can get another antibiotic down. But it comes straight back up in less than 5 minutes of hitting my stomach. And so we debate, well, what do we do now? Do we call the doctor and see if we could try another antibiotic? Maybe I'm allergic to this one again. Maybe my stomach's reacting to it. But inside, my head was screaming at me that there was something really wrong. But on the other side, I was thinking that the doctor must know best. And then my mum takes one look at me and says, "No, you look absolutely terrible. You're grey in colour mixed with luminous yellow, and really we should just go back to A&E for a second opinion." So we head back to A&E, where we couldn't have spent more than a couple of minutes with the triage nurse. She didn't really give me a chance to speak. She patted me on the knee and said, "Now don't worry, we'll get your wee antibiotic sorted out." And I say to my husband that she thinks I'm here because of the antibiotic and not because I've gotten worse. And he agrees. And A&E is mega busy, and we wait for another 3 hours. I don't even remember what the female doctor in green asked me, or even what she looked like. All I can remember is crying. And she tells me she needs to get another blood sample off, but she can't wait for the results, and we need to start an IV line straight away. I say again about my anaphylaxis to antibiotics, and she says something like, "I know, it's complicated. We don't have many options here. It's a serious infection, and we need to hit this with all we've got." So I know then that it's not good. And she starts IV fluids, IV antibiotics, and IV paracetamol. And I know at this point my blood pressure is low, as shortly after the nurse checks it and says, "Oh, that's good, your blood pressure has come up." And it had come up to 105. And later when I research how teicoplanin is reserved for life-threatening infections, I know I was a lucky girl and that doctor's actions saved my life. Then I'm asked to sit on a chair, still connected to the drip, and I have to wait a further 8 hours on that chair before a bed becomes available. There's 10 of us sitting in a row, and I can hear the staff and the bed booking lady having a freak out about how busy it is. 4 hours later, there's a change in shift, and I'm seen again by 2 male doctors. One is the senior medic. They don't ask me any real detailed history, apart from the fact that I have flu-like symptoms and to describe the pain in my back and chest. They never ask to speak to Ian either. They don't take on the story about being in bed for 2 days or that my temperature had been in the 40s, and they never ask any questions about urine output or vision disturbances. They never ask the questions that I've come to understand would have initiated sepsis protocols. Yet when I see them at this point, my new score is 4, where my blood pressure has dropped again, my heart rate has increased to 135, my white blood cells are at 20, and my CRP is still rising and has risen to 442. And because I'm walking and talking, I'm considered to be well and alert with no confusion, and they write in their notes that I'm anxious but comfortable, but really at this point I'm wired on the paracetamol, and it's the first time I've felt mellow in days. And I have to ask them again, is there any chance that I can lie down because I feel so ill? I've since been told that had I called the paramedics when I was a sweaty, comatose mess in the bed, that maybe they would have seen a different picture and I would have been reviewed differently. And I wanted to show you this photo that Ian took of me just before the IV line goes in. He took it to show our girls that I had Rainbow Dash above my head looking out for me. Now, you might think, well, it doesn't look too bad for someone who is seriously ill, but when I saw this at a later date, I can tell you now that my face is bright red and puffy and I look bloated. I also know that I've gained around 5 kilos of fluid at this point, as later I have a friendly argument about the ward scales being wrong, and I tell Ian that my stomach feels full and my pyjamas are tight. So I spend the night in the ambulatory ward, and I know I have a long way to go, and I know my body is fighting. I can feel my heart racing. I have tinnitus, and the high-pitched frequency is screaming in one ear, whilst my blood thumps in the other. I can feel the pressure in my head, my temples pulse, and it feels like my head might actually explode. Every part of me aches, my muscles and all my joints, and I jerk uncontrollably. I have the shakes and I sweat all over, including the palms and my feet. And the pain in my back is like being stabbed with a knife, but I felt totally wired, like I've been electrified somehow and plugged into an electrical socket. I can't sleep for more than 20 minutes at a time. And I think of the Renton in the movie Trainspotting doing the junkie limbo, and I feel just like that. And if you haven't watched Trainspotting, please watch it and you'll know what I'm like. And for 48 hours, I know my condition could go either way. It's 50-50, and I know this by the visions that I experience within that time. Now, medically, you may call these delirium, but spiritually, well, who knows? And I could tell you the story about the man in the boater hat who stood at the end of my bed and threw something over me, or the bodies I saw hovering over other patients, or the gremlin-type creature that jumped into the body of the woman opposite. Or what about when I was sent speeding down a tunnel, when I collided with it at the end, I hit it with a total clap of thunder, and at exactly the same time I went, I'm dead, and at the same time I entered this black nothingness. No noise, no sense of anything, nothing, just total black. And at the same time, I sat bolt upright in the bed and took a deep breath, something I have heard later referred to as the black void. When I'm transferred to the ward, it's my friend who's the sister, and she's a bit surprised to see me as I come in under my married name. And I tell her I have pneumonia and it's pretty serious. She takes a look at my chart and I can see the brief look of horror on her face, and then she goes into total professional mode and she tells me that I'm coping and not to worry and her team will look after me. And they do, and I cannot fault the care on the ward, totally different to the nightmare of A&E. I meet the older consultant on my second day in the ward, which is my third day of treatment. When he asks what my CRP level is, it's gone up again to 464, and he rolls his eyes and he looks at me and he says, that's some infection you have on board. And then he asks me about how I've ended up in this mess, and we discuss the events of the previous week. When I tell him I spent 2 days in bed where I couldn't even talk, he asks if this is unusual for me. And my friend and I laugh, and I tell him, yes, you normally can't shut me up, and that this is the first day in many days where I felt like I could actually speak. And this is when I hear I have sepsis, and I've never heard the word before, so I have to keep saying it over and over again in my head so that I can go and look it up after they leave, because I don't want to look stupid in front of my friend. He tells me how lucky I am and that I'm going to be exceedingly tired in the coming days and months, and after, what was I going to do about my business? And they reckon that the most likely place I picked up the pneumonia was 5 weeks previous, when I stayed overnight in hospital with my daughter Ruby, who was getting her tonsils out. And how could you ever have changed an event like that? So I spend 7 days in hospital, and my heart rate goes down, but my blood pressure goes up and down, and it takes to day 4 before my CRP and infection levels start to drop. And I know at least I'm on the mend, but my body is still a sweaty mess, I still ache, and I have to pee like every hour on the hour, like clockwork. My heart also starts doing this stupid skippy, starty, stoppy thing, something which I am still having investigated. But then norovirus breaks out and the ward goes into meltdown. You couldn't make these things up. And my friend comes to me on the Monday morning and she tells me they are sending me for bloods and a chest x-ray, and if I'm in any way fit, I'm going home. And part of me is totally scared to leave, but part of me wants to escape, because I know that if I catch norovirus, that's going to be me a goner. The discharge papers are short and sweet, and they say that my blood's settled, my vitals remain stable, and my lung improves. But the actual x-ray report says that there's only little improvement to a lung collapse and that the consolidation has still not resolved. So when I leave hospital, my blood pressure has gone up, my liver function is still out, and my CRP level is still at 90, so I am still unwell. It would transpire later that although my CRP eventually comes down, throughout the next 9 months I would become neutropenic, my platelets increase, and my liver function still hasn't returned to normal to this day. And it's not until I get home that I realise how ill I still am. My mouth is so dry I can't swallow properly, and I have a terrible taste in my mouth. I can only eat pureed soup as I feel so sick. My body twitches and jerks with muscle spasms. I still sweat. I can't stand bright lights, but I'm terrified of the dark. I can't stand the noise, but I hate the quiet. And it would take me 3 weeks before I could sleep more than 20 minutes in any 1 hour period without my body jerking. And I spent the next 3 months confined to bed and a month trying to get out of it. And I would dream of dying every single night for 2 months straight, like a disaster movie on repeat. And so I discovered that there are neither pneumonia nor sepsis protocols in place for recovery for my age, and the GP doesn't know how to help. I have to fight to get a district nurse to come in the first few days to take blood because they don't understand why I can't get out of bed and come to the surgery. I'm only sent home with 5 days of antibiotics, and luckily I get to speak to a senior doctor who doesn't want these stopped till we are sure the infection has gone, and this would take another further 2 weeks. And we agree to monitor my bloods weekly for a while, and I get assigned a physio to help me with my lung function and my mobility. And so I'm forced to do my own research, and I start to track my heart rate, and I learn what my normal vitals are for me. I learn that most of my symptoms don't seem to fit with pneumonia recovery, and this is how I find out about post-sepsis syndrome, and really it is such a huge mountain to climb. And I get friendly with my GP, and she tells me to ask if I need help, but it's only really now, 9 months later, that I know what I actually needed then. And I realise that recovery is not going to take a few weeks. It could in fact take years, and to be honest, when I know this, it's actually so much easier to deal with mentally. And for me, the most overwhelming symptom of post-sepsis syndrome, apart from the chronic fatigue, is the effect that sepsis has had on my brain. I couldn't watch TV, I couldn't concentrate long enough to read a book or remember what I just read, and I quite often forgot what I was saying. And so I spent 5 months working every single day on ways to use my writing and my drawing to try to increase my brain function. And as someone who is used to writing on a regular basis, when I would forget what I was typing by the end of a sentence, that was pretty scary. And this is the first lecture I've given in about 10 years where I've had to write notes. And so after 6 months, I write a marker post about how I feel that sepsis has basically poisoned every single part of my body, inside and out. And this is a big moment for me, as my father, well, he dropped dead of undetected heart disease 6 months after he had recovered from pneumonia. I call it being Humpty Dumpty, and about how I felt like I was having to put myself together again. And the list is long, and there is not one part of me that hasn't been affected in some way. From my bloods, to the effects it has had on my muscles, my joints, and the fact it has damaged one of my hips, to the pain I carry around in my back every single day where the pneumonia was, which sometimes hurts so much it feels like it's on fire, to the brain fog, the chronic fatigue, the total insomnia, and the post-traumatic stress, and to the more visible things like when my nails all cracked, my skin dried up, my hair fell out, and my eyesight changed, and to how sepsis has turned my hair white down both sides. And of course to the fact that I lived the conversation with that doctor over and over again in my head, and to know that if I hadn't gone back to the hospital on that second day and met the lady in green, I would be dead. After I publish my post on Facebook, I get lots of great comments and people start messaging me to connect. And people say there isn't really anyone actually writing about sepsis and sepsis recovery from a patient's point of view, and am I going to write some more? And so that's how my blog, Sepsis Vitality, was born. And it's about living life after sepsis. And I start to blog about my experiences. And I learn how to tweet, because when you're an artist, everybody uses Instagram. But as a medic, you all tweet. So I've had to learn how to tweet. And my audience grows, and I gain some fabulous followers, both medics and survivors. And I'm now thrown into this new world of being a sepsis warrior. And then I get in contact with the Global Sepsis Alliance, and they ask me if I'd like to become one of their 50 members, which I now am. And then I get contacted by the UK Sepsis Trust, and they offer to help me share my stories, but would I not consider joining them? And that's how I became the Northern Ireland lead rep for the UK Sepsis Trust, and that's how I'm standing here in front of you today. My role is just beginning. I'm looking at ways to work on a national sepsis plan for Northern Ireland and how to implement the Sepsis Trust Think Sepsis and Just Ask Could It Be Sepsis campaigns. And I'm learning about red flag and amber flag sepsis, sepsis 6 pathways, and all the other things you have talked about today. And I'm meeting some amazing local people doing some amazing work, and my job as a writer will be to help raise the profile of sepsis awareness in Northern Ireland. But you will be glad to know that that's a different story for another day. And so I'm going to end my talk by taking a photo of all of you so that I can tweet it to say that you're all here. So say cheese, cheese. And thank you for listening.